Skin rejuvenation. Let's talk about indications. Skin rejuvenation is a top indication for fluid PRF. And this is as it removes photodamaged extracellular matrix, as it does a synthesis of new collagen and accelerates wound healing. And moreover, it increases the proliferation of human dermal fibroblasts. Studies have shown a statistically significant increase in epidermis and dermis thickness, and also a better organization and higher amount of collagen type 1 fibers, and a significant reduction in solar elastosis. And there are many areas in the face where you can apply it. Want to point out the lower eyelid area now, because this area is very difficult to treat with conventional options. Of course, in the lateral area for crow's feet, you can use Botox, but at the medial part, it won't help you. Of course, if there is a severe loss of volume, you may consider using HA, but be very careful. HA can attract water. There can be a prolonged swelling. There are many products on the market that are not suitable for this indication. Just very few are okay to use if you have enough experience. I frequently see patients who came from outside. I'm treating a lot the lower lid area, came from outside. So we have to resolve to get rid of this wrong HA or poorly injected HA first with hyaluronidases, which is absolutely no fun in this area, because the hyaluronidases, if you want to get rid of HA, also affects the natural HA that is there. And then you need to build up the tissue again there. This can be done with PRP or fat. But the better way is to go for a very safe procedure from the beginning on. And this for me actually is fluid PRF. So this for me became really a first-line treatment for the lower eyelid area, for loss of volume if it's not too severe, for dark circles, and for excessive skin. And I want to show you some pictures from the study that I have published and conducted together with Matthias Aust and colleagues. And here we go. So you see a patient before, 4 weeks after the first, and 4 weeks after the second treatment of ACP. And you see the gradual improvement here. And it's important that you do numerous sessions and that it takes time. See another patient where you can get favorable outcomes 4 weeks after 3 sessions. Another patient, she's much older. You see wrinkles, you see thin skin, some bluish discoloration, and you see a nice and natural improvement 4 weeks after 3 treatments. Also in this patient, you see bluish discoloration and puffiness of the skin. You see that the elasticity is no more that good. And you see that we could improve that after 3 injections with ACP fluid PRF. Also in this gentleman, you can see a favorable outcome, but of course you also see some limitations, and you see that you cannot do miracles, but still I think it is a good outcome for a minimally invasive treatment in this area. If you have a look on this table, you can see that we did measurements with the QT meter. QT meter is a small device, you put it on, and it sucks in the skin with negative pressure, and with an optical system, it measures the firmness and elasticity. And the lower the R0 value is, the firmer the skin is. So the skin got firmer and firmer from injection to injection, and this was highly significant at the end of the treatment course. Same holds true for elasticity. F0 and F1 values dropped, which indicates a more elastic skin. And this was also significant. So long story short, we could show favorable outcomes. We could prove these outcomes with before and after pictures, but also with measurements of the QT meter. And one more remark I want to mention is that the typical burning sensation during the injection had not reported by any patient. This is most likely due to the fact that we have no anticoagulant in this ACP, Atrix ACP preparation. And the anticoagulant usually has an unfavorable pH value, which irritates the skin and causes a burning sensation. Let me show you a video how I'm injecting the ACP under the eye. I'm taking a 27 gauge blunt tip cannula TSK Steriglide. 25 gauge works as well if you don't have 27, but 27 is a little bit smoother. And the length is 38 or 50 millimeters. And you inject it very superficially, usually in 2 or 3 courses, just in this lower lid area over the muscle, obviously. And then you have some swelling here for 1 to 3 days. If you apply a Steri-strip and immediately some compression, you will have less swelling. And I tell my patients, be a little bit calm as long as the swelling is present. So don't go to the gym, running or jacuzzi today and tomorrow. When the swelling is no more there, you can do everything. So that works brilliantly fine. As I said before, for crow's feet, usually or frequently, I'm taking botulinum toxin. But sometimes I have patients who are seeking just organic treatment solutions. And this patient, I treated her with ACP 2 times and also got a favorable outcome in the lower lid area and in the crow's feet area. PRP and needling, this is also a very popular and good combination for skin rejuvenation. You can find here a staining on the bottom right. You see here in the staining, the platelets really find the way into the skin, but it's important to do it the right way. Of course, you need some PRP for simultaneous application with needling, but don't forget, there is bleeding at the beginning, especially at the beginning. So many of these platelets will just bleed it out again. So after you did the simultaneous application with needling, rub on again some ACP and let it really find the way into the skin for 5 minutes. Let it crust, and then you will have the best outcome. And several studies showed in a split phase design that the groups with PRP and needling had better outcomes than the needling alone. Based on that, Professor Pasch, Dr. Kolster, and myself wrote this book. And I'm happy to show you some of our clinical cases here. So they were treated with Artrex ACP fluid PRF and needling. Some areas injection, some areas just needling, and you can see these outcomes. The data actually on the right side, the picture was done 6 months after 5 treatments in her, and I think you get a really nice and natural result. Also in this patient, you see a very good outcome. Look at the lower lid area, look at the midface, look at the glow of the skin 6 months after 3 treatments. What is important for you? You all see also an improvement here in the midface for nasolabial folds. Well, there is an improvement, but on the left picture, she's smiling a little bit more, so it could be a little overrated, and it took a lot of time. It was 3 injections, 1 milliliter into each nasolabial fold, and then 6 months after, because the cells need to proliferate, yeah? So frequently, my first choice is HA for a filler, but if the patient wants to go for an organic solution, you do not need a solid PRF. Also with this liquid PRF, you can get outcomes like that. And the solid PRF will be resorbed very quickly, so you will not get a real filler there, yeah? So also in this projection, look at the fine line or texture of the skin and lower eyelid area, you see a great improvement 6 months after 3 treatments. This patient, end of her 70s, before and 6 months after 3 treatments. And you see a very natural outcome, a better texture of the skin and less wrinkles. Also in this patient, look at the midface, lower lid area and texture of the skin. You really see good improvements. Also in this patient, you see a nice outcome, and in that one as well. And that's how I'm performing the injection, bleb by bleb. Should just look like a mosquito bite. So approximately 1 ml for the left side of the face, 1 for the right, 1 under the left eye, 1 under the right eye, and the rest for forehead and chin. And then I also apply some PRP together with needling frequently, or I'm just doing a nappage technique that works as well. Beside the face, well, you can use it for rejuvenation of the hands, especially when the skin is very dry. You can get some good outcomes there. And you can also improve pigmentation a little bit. But when you have a severe loss of volume, then obviously you need the filler that's clear. But still, you can do something for your patients. The décolleté area, the neck, that works as well in terms of a better appearance of the skin, less sun damage, and so on. Post-laser, I guess many of you use lasers, and there is actually pretty good evidence that this is a good combination. I was invited to the Swiss Laser Society's meeting and asked to give a review on PRP and laser, and went on PubMed for CO2 laser, and 7 of 8 studies had control groups, so good design, and all of them recommended PRP and supportive therapy. Just want to point out a very few of these studies. This one is interesting, as here 3 areas in the face had been treated, and there was a control group with saline and fractionated CO2 laser. There was a group where after the laser, the PRP had been applied topically, and the group where PRP was applied via injection after the laser procedure. And you can see here a significant difference that favors PRP for the treatment, but it seems that it doesn't play a big role if you inject it or if you apply it topically. The channels are open after the laser procedure, but more than 4 days downtime without PRP and 2 or 2.8 days with PRP, that makes a difference for the patient. And also the acne scar, the depths were measured, and the depth was always the same at baseline, 92 micrometers. But after 6 months, you see a big difference. In the PRP group, 29 micrometer, and without PRP, 48. So that makes a difference. And also the satisfaction of patients and physicians was higher in the PRP group. So long story short, use PRP to get better outcomes, and it doesn't play a role if you apply it topically or if you inject it. Faster recovery from transepidermal water loss had been reported, a reduction of the downtime, a better histological outcome, and higher patient satisfaction. As I said before, the microarchitecture of the skin was also much better in the groups where PRP had been applied. Radio frequency, for those who are using RF or RF needling, I also have some good news. You can combine it with PRP or fluid PRF as well to get better outcomes. Another